of the persons with dementia, internet bandwidth connections, which is very famous in India. So these are problems, but particularly and more importantly, today we are robbed of the therapeutic effects of the human touch or the more effective non-verbal expression of communication to persons with dementia. Let us now have our speakers, distinguished professionals in their areas of expertise, present their views on COVID impact and implications on dementia care management. I'm privileged to introduce our first speaker of the morning, Mr. Premkumar Raja. Mr. Premkumar Raja, a social entrepreneur with 2 master's degrees in social science and has over 33 years of experience. He has experience as a community welfare and healthcare administrator. He's also the secretary of the ARDSI Bangalore chapter, and is a co-founder and secretary of Nightingales Medical Trust. Mr. Raja is a pioneer of home healthcare services in India, who has planned and successfully implemented several innovative social and healthcare projects in various parts of India. His focus areas of interest include dementia care, active aging, shelter for the homeless, combating elder abuse, and empowerment of seniors. Welcome, Mr. Raja. Over to you.
Thank you, Vidya, for this kind introduction. And at the outset, I wish to thank ARDSI for organizing this wonderful program. It's certainly my privilege to share our experience in managing care homes during these difficult times. Let me share the screen now with you. Are you able to see the screen?
Yes. Good.
Well, the topic given to me is management of care homes during COVID pandemic. As Vidya introduced, I'm the co-founder of Nightingales Medical Trust, as well as I'm the secretary of the Bangalore chapter of ARDSI. Well, you all know globally, the care homes are worst affected during this pandemic time. This diagram shows, how badly the care homes were affected in the developed countries. But in our country, though it has affected, but we don't have any reliable data on to what extent it has affected care homes as far as prevalence and deaths are concerned. So these are the major challenges posed by COVID on care homes. First one is in a care homes, we mostly have elders and they have multiple health issues and they become more vulnerable to this COVID. And due to various reasons, due to dementia, they're not able to explain clearly, what they undergo. And even if they have fever, they cannot, communicate. So it's really become a challenge, for caregivers to find out and act immediately. Implementation of precaution measures, we all know that's the only way, to keep ourselves safe. But when you work in care homes, only we know how difficult it is to implement the basic precautionary measures such as wearing of mask, hand hygiene, social distancing, etc., etc. And due to various reasons, the cost of care has gone up during the 6 months. So maybe in my following slides, I'll explain to you more what made as maybe to what made increase the cost. Being a service industry, we completely depend on staff. And here, in this case, without staff, you can't manage care homes effectively. There are several issues, we had to handle with staff. Staff had, they themselves, they have fear, anxiety, and the families were not allowing them to come and work in care homes. Not only families, there are certain cases, maybe in the apartments where they were staying, the other residents were not allowing them to stay there. It affected them to come peacefully and come and work in our place. And also from government side, there's no clear guidance, because in this type of situation, when we are directionless, we obviously look to government for guidelines. And maybe now to some extent we have something, but initially we couldn't have any proper SOPs from government side. Well, this is what about our experience in managing care facilities, and we have 4 care facilities. The main one is located in Bangalore. It has 98 care facilities called Nightingales Center for Aging and Alzheimer's. Second one, we have Kolar. It is about 60 kilometers from Bangalore. There we have, it's a 70-bed facility. It's again mostly with dementia patients. Third one, it's located again in Bangalore. It's only for women, care facility for dementia patients. And finally, we also have a destitute home for elderly women. It's a 70-bed facility, and 60% of residents there have mental illness. So, and but in all these 4 centers put together, we have been managing about 208 residents in the past 6 months. Well, our experience is different from each home, but I thought maybe in this presentation, I can focus more on our experience at a main center, Nightingale Center for Aging and Alzheimer's. And other places, it's almost same. What are the practices, what we have developed over here? So let me focus more on NCAA. So this is a center established in 2010, and it's located in Bangalore. It's a 98-bed facility. And during this time, we have been taking care of about 85 elders with dementia there. So this impact COVID has made on NCAA. Though we have started taking steps mid-March, but the initial phase, it was full of shock, fear, anxiety, and uncertainty. In fact, the numbers were not there, but it's a huge shock when government announced lockdown on 23rd of March. And we really don't know, the seriousness of the epidemic. Some of us were taking it lightly, some of us quite seriously. We didn't really have the direction. And all of a sudden, all the public transport services stopped and staff could not come. And we couldn't get some basic essentials like mask, gloves, IR thermometer, pulse oximeter. It was not available, one, and secondly, it was so expensive. It has become so expensive, to source these things. And also, there was no verified information about, the virus initially. So that left us directionless. We didn't know how to proceed. And the side, family is also quite anxious. Well, then we had to take a very conscious decision. At the time, we were hearing the second phase, how COVID affected care homes, especially in Europe. We could hear or read in newspapers, how badly, they were affected. That really enhanced our fear. No doubt about it. And we had 2 options. At the time, even maybe old age homes in our city, some of them were closing down, and because already staff, there's no staff, and you can't really run a home like this. So we had 2 options, whether to close the homes, or asking the families to come and take the dear ones back, or to run. But very consciously, we took a bold decision of running the care homes during this difficult time. The first thing that during the phase 2, what we had done was to form a crisis management committee. So knowing, the seriousness of the pandemic, we formed a committee with experts, doctors, specialists, and medical professionals and other social workers, how to handle the whole thing. This committee formed with a clear purpose. And the first task was, for them to monitor, the centers more closely, besides developing protocols, guidelines, and SOPs. So they started doing it. And once that was done, that maybe the month of April, and Even at the time, the numbers were, not really scary, but slowly it was increasing. Then the month of, immediately afterwards, we started implementing the protocols in a very strict manner. So we had to take some important decisions about infrastructure, staff, admissions, and about the visitors. We were expecting the government also, officers where health department was busy with their own, because they had a lot of other priorities. We thought government would come and make a visit and tell us how we should proceed. Because with a lot of uncertainty in the sense, those days I'm talking about April, May and all, if any positive cases found in a nursing home, immediately government will come and lock it up. All the patients used to be shifted to other places, and the whole place would be locked down for a few days. That was quite scary. So we didn't know what will happen to us. See, maybe in a nursing home situation is different. Patients, they're shifted from one nursing home to other hospital, doesn't make much of a difference. But just imagine in our center like this, we are getting one positive, and immediately government and asking us to vacate everybody, 80 plus people to other places. It's not going to be easy. Other staff who are going to manage them, they are not trained, and already our patients are so much confused looking at staff with masks, and they didn't know what exactly happening. Their family members were not visiting, so a lot of confusion. So that was the biggest fear on us. What if at all something happened, what would happen to our residents? So we were very, very careful, in planning and implementing. It was certainly the most daunting experience for us, the 6 months, to manage these care homes in a safe manner. But finally, when government was not coming, we ourselves, we initiated, we met the officers and invited them and brought them to visit a place, and at least to certify that things are going on well in writing. Then later, what we need to do in case of emergencies. So looking at all the protocols, they said everything's fine, though they didn't have. In fact, they took the protocols and they started sharing with WHO, etc. But in all these phases, we were keeping families informed. The first thing, we asked them not to visit, but we were constantly keeping them informed, all our families, what exactly were going on here. So now I'm going to tell you how exactly we were managing the situation during the time. As I told you, the first thing was about the protocol, and it was developed, it was displayed in different places, and staff were trained how to follow them. And the second slide, we are seeing the government officials visiting our facilities and offering, guidance. As part of a precautionary measure, the first thing what we have done is that we control the direct access to our care facility. That was sealed almost, except for emergency or ambulance movement. We opened up our fire exit at the rear side. So that was made as a main entrance. That enabled, the care facility to have 2 layers of security cover. And visitors and admin staff were asked to use only the rear side gate, and they were not allowed to enter residential block. And whoever was coming, temperature was checked, hand hygiene performed, and without mask, we are not allowing anyone. And staff were very closely monitored, and if anybody having temperature, they were not allowed inside. And kitchen staff were specially trained, and whatever all precautionary safety gears were provided to them. The staff, entering the second layer of the care facility, they were again checked, and to ensure that nobody carries any infection inside. And immediately, maybe in our biometrics, we replaced the things with the facial recognition instead of having the fingerprints. Same way, visitors, though we restricted, but still there could be some visitors or vendors used to come, but they were very closely monitored. Initially, family members were not allowed, but from the month of August, we started, because here you all know that handling dementia patients, here their interaction with family members is very, very important. So as such, they are confused, and when they are not meeting the dear ones, they get more confused. and the behavioral problems may increase. So we had to know how long we can handle these things through virtual meetings. So we had to allow that. But again, we developed some protocols for allowing visitors, and a separate lounge was created for them, and with furniture, with the transparent partition, etc., so that nobody spreads the infection inside. And this is how the residents were monitored well, and we used to check the temperature thrice a day, and oxygen level was checked every day. It was documented. Even now we have been doing that. All residents vaccinated with the influenza. Anybody having flu-like symptoms, immediately they'll be isolated and closely monitored by a medical team. COVID test done if symptoms persist for more than 3 days. And also we had this herbal drinks, Ayurvedic drinks, we don't know to what extent that helped, but at least psychologically, we were providing that to our residents as well as staff. A center like this, elders fall sick and we had to admit them to hospitals. But during this time, we strengthened our medical team to ensure that we minimize shifting hospitals to residents to the hospitals, because our worry was if they get into hospital, they may catch the infection, and or probably they may bring infection also to our center. So we strengthened immediately our medical team, and to the maximum possible, the acute problems were handled at our center. For the families who couldn't visit our centers, we have been still continuing this virtual interaction through Skype or video calls. That's how families also, they're happy and they get a reassurance that the dear ones are taken care of well over here. One important decision I have to mention here is we immediately reduced to the number of caregivers. We divided into 2 parts, and one is in rotation. We started working and making one set of staff to work here maybe for a longer hours, and we made everybody stay inside. We didn't allow any caregiver or a staff who have close contact with the patients not to come from outside. That is a very strict rule that we have implemented that we'll be following till end of September. It's not easy to follow. Convincing the families and making staff come prepared and stay over here. Temporary hostels were created and we made them stay inside the building. That to a greater extent helped us to contain or to maybe to prevent the virus getting into our campus. And caregivers were to motivate them. We provide them good food, risk allowances were given, and so we were keeping them happy to the maximum possible, and they were getting stressed. But just imagine young girls, they were having good time when you go out, but now it's almost like a jail, staying for a few months inside the buildings. So continuously, maybe having de-stressing activities, a lot of fun activities, games to make them, happy all the time. So these are the major structural changes we made in a building. One is we created observation unit. So though during COVID time, initially we were not allowing admission, but we can't remain like that. But we have been getting a lot of inquiries. Families were suffering outside and with various behavioral issues, and they were asking us to open the admission process. So we had to construct this small room as admission unit, observation unit. So this is the one-to-one caregiver support, and anybody getting admitted after our assessment, they'll be kept there for 10 to 14 days based upon physician's advice. Then afterwards, like COVID, maybe before moving in, COVID test would be performed, and only when it is negative, they would be taken inside our premises. This enabled us to help families who are having tough times outside during COVID times by admitting such patients in our care facility. We also created step-down ward. Earlier, whenever people fell sick, we used to treat them in their beds, but now we created a step-down ward in our main block. Anybody not well or anybody having flu-like symptoms, they will be immediately shifted over there, and doctors would, our medical team would monitor them quite closely. If at all the symptoms persist for more than 3 days with the medications, immediately we used to inform the government command center as per their directions. Whenever the patients were shifted there and we used to fumigate the ward so that the place is kept clean all the time. Yes, initially we are not allowing staff go out and come back, but practically it's not possible all the time, because few instances staff had to go out and come back. Even that, when the staff go and come back, we didn't allow them to mingle with other staff. Maybe 7 to 14 days, we created the small room. They used to be kept there and for quarantine, and only after they don't have any symptoms, they would go to a regular hostel and to do the regular job. With janitors, they're very important, and they're trained on infection control measures. Hygiene infection, very important. The places frequently touched by patients or others were cleaned with sodium hypochlorite solution. This is all as per the directions of the government. Government asked us to do that, and we have been following that. Elevator buttons, doorknobs, handles, railing, everywhere. And with the vehicles, ambulance, whenever it goes out, every time cleaning it up, like and disinfected. Frequently mopping the floor, more than like what we used to do earlier. And at Nightingales, training is sort of an integral part of our system. So because that is, it goes like, not only the initial training, like, it's ongoing process there. And during this time, and we have strengthened like the training by adding maybe a few chapters on how to management of in a patient during COVID, and how they should maybe prevent such things like mentoring things. So this COVID management training, now we developed a small curriculum, and all our staff, not only the caregivers, nurses. So here our system is, even we train our kitchen staff, our security guys, how they should manage this epidemic. Initially, though we have storeroom, we keep all the things, but we really had a bad time because we couldn't source the essential supplies. So we learned it, and now our stores, we have all surplus. Anytime anything happens, at least the system is, we should be able to run this thing without sourcing anything for next 3 months. That's how stores are maintained now. So these are the major achievements, I could say, that the past maybe this is, but till now it's still not over. We really don't know how long we are going to face this, but till now no COVID case has been reported till now in all our 4 centers. We really feel it's not something easy. Maybe our teamwork, it's careful planning, protocols, and teamwork, with that only we could manage. It's not easy. It's not something, I know that even in Bangalore, one more dementia care facility, I heard that when 7 people got infected. So it's so difficult, to manage every day, new things we have to learn, and we should try to implement. So we feel it's really a big achievement so far, but we don't know how we are going to sustain it, till we come out of it. Though the cost of care gone up by creating additional facilities in a place, providing more services or maybe facilities to the staff and various other things, infrastructure, etc. The cost has gone up, but we have not passed it on to our clients. That we took a policy that we have to keep the cost, whatever we charging earlier, we want to keep it the same level. Yes, staff were having problem, but with continued our efforts and keep the morale high, and the staff attrition and turnover, it is very, very minimal. We also, though we couldn't have our regular memory clinics, but we immediately start online memory clinics. So we started online assessments and started admitting patients. So the continuity of care, it was not disturbed during lockdown period. And finally, we also could develop a model, a protocol, maybe for care homes, but of course it varies from place to place. And I'm sure that we feel that we could develop that. Going forward, based upon experience, we feel, like Nightingale, there are many other homes. I know even through RC, there are run homes in Kerala running, or maybe some of my other colleagues running Pune, Calcutta, various other places. How to capture the data, the best practices, document and publish. because now it appears like, the problem is going to be this for a longer time and something may come and COVID goes. So we have to be prepared as they are more vulnerable to this type of viruses. And it's a time government should take it most seriously, because in our country, we don't have any minimum standard for care homes. And keeping pandemic in mind, we should develop a document. Minimum standard for care homes is the need of the time, and we have to have it. That's the only way we can keep the residents and staff safe over there. And also, now the whole dynamics have changed. Even it will be in architecture, care management, everything changed now. Like, the pandemic changed. So we have to create, like, maybe we have to make the care homes pandemic proof. This is how, like, I think we all have to work together, maybe to be architecture, care of the people are managing the staff, resources, everything we have to really plan a lot. As COVID is expected to stay for a longer time, we should be prepared to handle any type of crisis any time. It's not that it's going to be over. We should be really prepared, maybe in the interest of the patients and the staff. Training is going to be playing a very important role, and especially on COVID prevention management. And also, like, probably we may need to undertake some research study to study the efficacy of Siddha or Ayurvedic medicine to boost the immunity of elders, and especially those with dementia. And the cost of going up, it's not fair on a part always to pass on it to the residents, is not right. We have to find out how to utilize, the optimal utilization of resources, so that, like, so quality is not compromised. At the same time, like, the cost of care is kept minimal. So these are things, like a few suggestions of which I wanted to bring it out. So with this, I want to once again thank RC for organizing this wonderful program and giving me this opportunity.